To encourage clients to continue to exercise, set realistic short-term and long-term goals. So this may frequently change based on where they are in their chemo cycles. The effects of chemo are cumulative. Generally, once they get into cycle, they kind of know their good days and which aren't their good days. And so we want to encourage them to do their more strenuous exercises on their good days and on the not good days, to just try and limit physical inactivity, just to limit the sedentary time as best as they can, to take some walking breaks, even if it's just around the house, just not being sedentary. We want to make the workout fun, of course. We may need to offer extra words of encouragement to build confidence. We want to do a variety to maintain interest, encourage physical activity with family and friends. This seems to be very important. In the research we're finding, in studies where they had the cancer survivor do the exercise program with somebody that they live with their romantic partner, with just any partner in general, they tended to be more successful than just doing it on their own. And we know that social support plays a huge role in our exercise. For most of us, I'm sure, if we know we have a friend waiting for us to go on a run, to meet at the gym to lift, we're more likely to not bail on them, like we might bail on ourselves, and to show up for that. And a friend once that we had a deal that if one of us complained about I'm not in the mood to exercise, the other one was not allowed to say that. The other one had to be like, nope, we said we're going to exercise, we're going to do it. We can use exercise logs to document progress. You can also do fun things like count the miles and all right, it's so many miles from Houston to Galveston, so we're going to see if we can walk there in 50 miles. We're going to see if we can walk there in 10 weeks, or whatever you think is a reasonable goal. So just something kind of fun like that. And of course, we want to encourage client input. If a client is telling you, I really don't like to do this exercise, then what can we do instead? If it's something that we know we want the person to be doing, that we know is good for them, how can we change it to help them? If they're really don't like, push-ups, but that's really good for their body strength, and that's sort of an area of weakness, can we do a chest press or something else instead? Contraindications of vigorous exercise includes acute onset of nausea after exercise initiation, chest pain, decreased heart rate and blood pressure with increased workload, irregular pulse during exertion, disorientation and confusion, dizziness or blurred vision, and intravenous chemotherapy within the last 24 hours. So some maintenance chemotherapies, it's an oral chemotherapy every day. That's a little bit different than if they're getting an IV chemotherapy. So except for that last one, that's specific to chemotherapy, the rest of these are all contraindications of vigorous exercise for anyone, but it's something that's more likely to occur in a cancer survivor, especially if they're in treatment. And we have some more. Yay, isn't this fun? Sorry, the fun is cancer, you have all these side effects to worry about. That's I thought that was a little sarcastic comment there. So leg pain or cramping, bone weakness from long-term use of prednisone, so it's a steroid. Numbness in legs or hands, that's the neuropathy that we talked about. Pallor or stenosis, so just not the color not being right. Difficult breathing or shallow breathing, unusual muscle weakness, and vomiting within the last 24 to 36 hours. We really want to make sure that the exercise isn't causing further dehydration in the cancer survivor. So you want to wait a little bit if they're having some severe issues. Okay, so let's go back to this slide again with the effects of exercise on health-related outcomes for those that have cancer. I know this is tiny, but again, you have the handout to look at. With cancer survivors, this purple bar at the top. Overall, avoid inactivity and improve general health. Aim to achieve the current physical activity guidelines for health, which is 150 minutes per week of aerobic exercise and 2 times a week for strength training. So that's our goal. ACSM recommends that because we know there are health benefits in 90 minutes per week, but 150 minutes is really where we start to see a big decrease, that with cancer survivors, it's okay to aim for the 90 minutes instead of the 150 minutes. Some exercise is better than none. The 150 minutes, we have really good evidence that that is what is needed to reduce cardiovascular disease. So that's why we do the 150 minutes. But if it's difficult to get somebody with cancer, if they're having weekly chemotherapy or even biweekly chemotherapy, let's say. So let's say they have biweekly chemotherapy and the first week after their chemo, they're always feeling pretty bad. But the second week, they're feeling pretty good, they can exercise. So they can only exercise every other week. Or that's when they're comfortable exercising. We're not going to average 150 minutes a week. Can we get them to average 90 minutes a week instead? What can we get them to do that fits within their time constraints, their how they're feeling? And then after their cancer is in remission and they're post-treatment, then we can work on ramping up the exercise further. But let's try and just get what we can. And again, if there's something specific that they have a complaint on, not a complaint like whiny, but just a complaint like, hey, this fatigue is really difficult to deal with. Here's the prescription, the evidence-based prescription for what to do that. So we're working towards just our general adult exercise guidelines, 150 minutes per week of moderate exercise, 2 days a week of resistance training. But here's some additional fit aspects that can be used. For exercise prescription, with each exercise session, we have some precautions we're going to take with the person. Just like with anybody, we want to make sure we're doing a warm-up. Before the person does the warm-up, when they first come to you, you want to check to make sure their resting heart rate is below 100 beats per minute. If it's above 100 beats per minute, then check with a physician before continuing. Elevated heart rate can indicate several things. It can indicate infection or some autonomic nervous system issue that might be common if it's some with breast cancer that had radiation. That can happen. It can affect their heart. So we want to make sure that's okay. If their resting heart rate's below 100 beats per minute, we're good to go. We're going to do the warm up, and as long as we do the warm up, we have them walk on a treadmill, do some light exercises. We're expecting the heart rate to increase 10 to 20 beats. So we want to see that increase. We want to make sure that we didn't, we check them and it's like, all right, you're 88, we're good to go. And then you have them walk on a treadmill for 10 minutes at 3.5 miles per hour, and their heart rate has only gone up to like 90 or 92. That's not good. It should be higher than that. So we'd want them to get that checked out before doing exercise. And then of course, end with a 5-10 minute cool down like we do with everyone. For cardiorespiratory and cardiovascular training, we use stationary bicycles, treadmills, outdoor walking programs, whatever we have available for the person. If it's closer to their house, they're more likely to do it than if they have to go far away. Interval training can be highly effective. This is also getting back to the psychological aspect and the self-esteem aspect. A lot of times when a cancer survivor, especially they're in treatment or pretty near to having ended their treatment, they might not be able to, they're probably not going to be able to do the exercise they were doing before. Maybe they were running 5 miles 5 days a week, but they're not able to do that. And so if we do interval training, we have planned breaks. So the person doesn't have to be like, I can't finish this, I need a break. Instead, it's all right, we're going to do 2 minutes of exercise, and then we're going to do 1 minute stretch, and then we're going to do 2 minutes exercise, 1 minute stretch, or whatever. We're going to do 2 minutes getting your heart rate at 70% heart reserve, and then a 1 minute recovery exercise, however you're doing it. But that way, again, self-esteem, it's not, I can't do this, I need a break. It's, oh, I'm supposed to be taking a break as part of my exercise plan. Ideally, we're going to have somebody starting at 3 to 5 days a week at a low to moderate intensity and work up to 20 to 60 minute bouts of exercise. For resistance training, this is not as well studied as cardiovascular training, but I still think it's very beneficial for cancer survivors. Any types of modality is acceptable. Again, if they have peripheral neuropathy in the hands, might not want to do hand weights or resistance bands, but we can figure some exercises out. One of the things that's important is we only want to train them 2 to 3 days per week with at least 48 hours rest in between. So it's better to do an entire body workout that works all major muscle groups so they can get that 2 days rest and come refreshed and reduce their risk of complications. We have additional guidelines when working with cancer survivors. We generally monitor blood pressure and heart rate before, during, and after exercise. It doesn't need continuous monitoring with the blood pressure, but we generally, after warm up, want to take their blood pressure to, again, make sure it's responding correctly. As with anybody, if dizziness, nausea, or chest pain occurs, definitely stop the activity, get that checked out immediately. We may need to start more slowly and build even more slowly than with the general population. This is called low and slow. So start them at a lower intensity and do a slower progression. And if the person has a temperature of at least 101 degrees Fahrenheit, we want them to avoid exercise. It may be an indication of infection or some other complication. And this is always good advice. We shouldn't exercise with a fever. ACSM has this really great handout. This is in the topics folder for this topic, lecture content folder. And what they have here is some health-related outcomes. So let's just call it concerns of people with cancer. So cancer-related fatigue, anxiety, bone health, sleep, and then what's recommended for aerobic resistance and combination aerobic and resistance. So if somebody has fatigue and they want to do both aerobic and resistance, then what's recommended based on the research is 3 times a week of 30 minutes per session, moderate intensity, plus 2 days a week of resistance training, 2 sets of 12 to 15. So this is really helpful for a couple of things. One, you can have the person be like, all right, so what are the side effects that are really bothering you that you'd like to address with exercise? And then we're like, okay, well, here's what's recommended for this. This is what our target's going to be. I'm just going to end with some kind of fun slides. This is a little robot, kind of like the delivery robots we have on campus. But this is in a hospital, and it's delivering the chemo from the pharmacy to the infusion center. And prescription may have additional limitations. Specific to both of these, the treatments and medication may limit heart rate response. It may be difficult to do an exercise prescription based on heart rate, and it may be difficult to do an exercise test if heart rate is what we're using to predict their fitness. If you're doing a 2-stage treadmill test, if you're doing some other tests where you need the heart rate to be able to predict the fitness, we're not going to be able to do that in all people. One of the tests that's commonly used is the 6-minute walk test. It was originally developed for pulmonary patients and is frequently used to assess cardiorespiratory fitness in cancer survivors. Also frequently used in older adults, and you will do this test in the older adult testing lab later this semester. It doesn't require measuring heart rate at all. It's just the distance walked in 6 minutes. So we can probably adapt this test, and other tests can be adapted as well. For exercise prescription, there are additional risks. For example, somebody may have established upper extremity lymphedema, so swelling, a type of swelling. This is the case. They may be needing to wear a compression garment during resistance exercises, and we may need to have them progress their weights more slowly. Someone with metastatic lesions should avoid direct musculoskeletal loading or loading of the muscles that are proximal to these lesions. Neuropathy, this is often a side effect of some types of chemo. This can be a feeling or loss of sensation, lead to loss of sensation in the limbs, the hands, and the feet, especially the feet. That's a concern for us with exercise because if they're doing walking on the treadmill, we need to make sure that they have the feet underneath them. I had somebody with peripheral neuropathy describe it as they felt like that they had clown shoes on. Like they knew generally where their foot was, but they couldn't pinpoint exactly where their foot was. Kind of like if you wear clown shoes, where they have, the shoe is twice as big as your foot. That was kind of what it felt like. They didn't know exactly where their foot was. They just knew it was somewhere kind of in a general location. Similarly, if they have neuropathy of the hands, we'd want to be concerned about them doing free weights, especially above their head or something, for example. So we would modify with this. In these cases, people can do elliptical. You aren't lifting your feet, so you don't even know exactly where your feet are. Cycling, stationary cycling. We can do stacked weight machines instead of free weights. So we just have to think about what we're going to do instead with these people. Ostomies. So this is common with colon cancer, especially advanced colon cancers. We need to adhere to infection risk reduction procedures and generally want to avoid contact sports and exercises that cause a Valsalva maneuver. It doesn't mean they can't resistance train. You probably want to get to have them clear it with their oncologist first. But we may have a really low weights to do with them. At the very minimum, reminding them to exhale with the lifting to not induce the Valsalva maneuver. Some of the side effects that exercise helps with include treatment-associated fatigue, loss of functional capacity because of chronic pain, nausea, and vomiting, cachexia, anxiety, depression, low self-esteem. They may be at an increased risk for infection and at a risk for dehydration. So these top four exercise can help with, and the bottom two exercise doesn't help with. It just exercise may make those worse. We need to be careful with that. Treatment-associated fatigue is one of the largest barriers we encounter with trying to get a cancer survivor to exercise. And it's not fatigue like they need to go take a nap. It's fatigue like they just want to sit down and not do anything just because they're so fatigued. And it's really difficult to convince somebody that if they just do some exercise, that it will help with their fatigue. What I've heard from cancer survivors is that the second session is the worst. The first one, the fatigue's not great. The second one, you had the fatigue of the first session, you fatigue everything else. And then if they've said, like, once they push past the second one, it starts getting better. And that's not going to be the same for everybody. That's just what I've had some cancer survivors tell me. I've heard 2 weeks being thrown around. I'm assuming the 2 weeks is assuming the 3 to 5 days a week of exercise, the recommendations. So that's a little bit longer. So that's it's a hard thing to get people to push through. Maybe they'll listen to some research that you present them with, or at least if you can get them into doing it for 2 weeks, maybe we can get them to do it longer. All right, some additional precautions. If they're undergoing radiation therapy, they may be told to avoid chlorinated water because it's very irritating to the skin, as is radiation therapy. Again, it's not going to be everyone, but if they've been told that, then we need to not suggest swimming or water aerobics as an activity. They have a bone marrow transplant. They're usually told to avoid public places like fitness centers for at least a year. You do some home-based exercises instead, or outdoor exercises. Also, swimming pools should be avoided if possessing an indwelling catheter usually. And if they have peripheral neuropathies, we want to avoid activities requiring extreme balance. We don't want to challenge their balance too much with that. But again, these benefits of exercise include reduced fatigue, reduced incidence of nausea, vomiting, diarrhea, improved functional capacity, improved psychological functioning and self-esteem, decreased risk of recurrence for some cancers, and decreased risk for other chronic diseases. I want to hit on this psychological functioning and self-esteem really quick. When somebody is told they have a cancer, somebody's told a cancer diagnosis, a lot of stuff becomes out of their control. They have all these appointments. They don't have a lot of control over their schedule. It's just, you need to come in every other Friday for your chemo. You do this, you have this other business, stuff like that. And just in general, there's a lot of stuff they don't have control over. But there are other lifestyle factors, exercise and nutrition, they do have control over. If they have a type of cancer that's very slow growing, like some prostate cancers, for example, some chronic lymphomas and leukemias, they go in a period of watchful waiting where there isn't any treatment that's done. They just have frequent monitoring to see if it progresses to a stage where they do need treatment. And again, that's, you're told you have cancer, but you're told we're not going to do anything about it. That's, again, causes some psychological distress and can be a hit to the self-esteem, which exercise can help with. Again, that's something that they do have control over. And that's another way to kind of sell it. Wish I could find the study, but I read a study once. And within the first year is when cancer patients and survivors are the most motivated to make changes to their exercise and nutrition. So we need to get those habits developed before they lose interest of like, well, nothing's bad happened to me. I've survived a year with cancer. I don't need to continue these lifestyle changes. We need to get them hooked on the exercise instead, right? Let's talk a little more about the relationship between physical activity and colorectal cancer risk. In research studies, adults who increase their physical activity, think about this with the FIT principles, can reduce the risk of developing colorectal cancer by 30 to 40%. This is regardless of body mass index. This physical activity was a stronger predictor, strong enough to overcome body mass index issues. And the greatest risk reduction was observed among those who were the most active. So the magnitude of the protective effect appears with the greatest intensity exercise. So higher volume, higher intensity is the greatest reduction. It's difficult to determine the optimal levels because it's difficult to compare studies. Somebody did 30 minutes 5 times a week. Somebody did 20 minutes 6 days a week. It's just really difficult to compare. But it's estimated that 30 to 60 minutes of moderate to vigorous physical activity per day is needed to protect against colon cancer. This is part of educating a client. And for some people, this is very motivating to know that exercise is reducing their risk for developing chronic diseases. For other people, it's just good to know. It's helpful for them to know the benefits of exercise outside of feeling more fit or losing weight or whatever these other goals are that tend to have an endpoint or are harder to achieve. So why is this? There are probably multiple mechanisms. Some of these include energy balance. So that means your caloric needs meeting your physical activity level. Hormone metabolism. Insulin regulation. Insulin regulation is big in cancer cells. And by big in cancer cells, I mean that insulin plays a role in like other cell growth and cancer cell growth as well. So it's hard to talk about cancer cells, especially colon cancer, without talking about insulin. And by decreasing the time the colon is exposed to potential carcinogens. So exercise improves digestion. So it may be that somebody eats something that is not good for them, let's say red meat, that it moves faster through their digestive tract than somebody who doesn't exercise. So that may be one of the benefits. And then also inflammatory and immune factor. I have a question mark there because that is not as well established in the research, in the literature, but that is my line of research. And so, of course, I'm going to mention that because I think that is one of the links between physical activity and colon cancer risk. Is physical activity improves our immune system, it reduces systemic inflammation, and that this is one of the mechanisms for the risk reduction. One other thing that exercise can help with in cancer survivors is cachexia. And cachexia is low muscle mass and function, just like sarcopenia. But there's an inflammation to its etiology. There's this breakdown of muscle function. And cancer survivors who have cachexia have a worse prognosis than those who don't. So again, all things being equal, if one is cachexic and one is not, the one with cachexic is going to have a poorer prognosis. Approximately 80% of people with advanced cancers have cachexia, and it's associated with a chronic disease. So cachexia isn't unique to cancer. Somebody could be cachectic and have COPD or chronic heart failure. So something that impacts their muscle function. Some cancers, some treatments are more associated with cachexia and others are not. This is just kind of a little, again, I like the figures. So high inflammation in cancer and cachexia. So there's a tumor, which has a very inflammatory spot. And that's going to lead the body to a pro-inflammatory state, which is going to help fuel the development of cachexia. So for example, if you have inflammation and that leads to disease, and disease has all sorts of side effects associated with it, including muscle loss, skeletal muscle loss. A loss of skeletal muscle mass tends to lead to poor fitness. If somebody has poor fitness, they're not being as physically active generally, which means their inflammation gets higher and so forth. So it's this cycle. But fortunately, exercise can help it reduce the effects of every single one of these steps. Chronic exercise is anti-inflammatory. Acute exercise increases both pro and anti-inflammatory immune cells and products. But the overall chronic exercisers have lower inflammation than people who are not chronic exercisers. One thing sometimes that's hard when we're doing exercise recommendations for people with chronic diseases, and cancer being one of these, is the family may view the person as needing rest. And I picked up on this. I took this little snippet from the Mayo Clinic website because this was very pertinent to what we see. And I've observed this with patients and their families. So the certified exercise trainer at the Mayo Clinic's Healthy Living Program says physical activity can help people before, during, and after treatment. We've been over that today, so it's confirming what we already know. We've already discussed. And then she has this quote: loving family members may be urging a person with cancer diagnosis to rest, but that can lead to functional decline. Research tells us in general it's better to move more than less. So that's just a kind of a pointing out that if you have the person's caretaker with them, when they're family members, they may be like, no, the person needs to rest. They shouldn't be lifting heavy weights. They shouldn't be walking that much. They shouldn't be breathing heavy due to the walking. And it's tough because we know the person saying this because they care about their family member, but we also know that that's the opposite of what needs to happen, that they need to be exercising in the vast majority of cases. And for example, physical activity after a diagnosis of breast cancer improves quality of life, reduces fatigue, and assists with energy balance. All things that these loving family members are probably concerned about with their loved one. So exercise can help with that. And it can help reduce the side effects of treatment. For example, after a breast cancer diagnosis, there's a link with weight gain, and exercise can help reduce the amount of weight gained. From our neighbors at MD Anderson, they have this helpful little figure about why exercise reduces anxiety and depression, healthy heart, breathe easier, maintain a healthy weight, strengthen muscles, and more energy. So these are some reasons why somebody with cancer, a cancer survivor, should exercise. Background on some physiology with cancer. So there are hundreds of different types of cancer, and it's distinguished usually based on the site of organ. Genetic testing is very commonly done because that will help determine the course of treatment. So some chemotherapies work best with certain mutations, and so that is done as well. It can originate from just about any cell in the body. Cancer is malignant, and cancer is also easily metastasized to other organs, meaning it spreads. Usually the metastases is a late stage cancer, so usually stage 4, maybe end stage 3, but that's not good. So cancer is a destructive growth of cells. And throughout the day, throughout our lives, we all have cancerous cells in our body, but our immune system is really good at taking care of those. It's not that we have that cell that mutates and is cancerous, but that it escapes our immune system and is able to hide somewhere and grow. So it's not the cell itself, it's when the cell grows that it becomes detectable and malignant cancer. Cancers can spread a couple ways. It can spread through the lymph nodes and the lymphatic system. It can spread through the the veins through our regular circulation. It can go to neighboring organs through this way. There are 4 major categories of cancer. This includes carcinomas, which is in the epithelial tissue of the skin or of the lining of internal organs. So, for example, colon cancer, that's a carcinoma. Breast cancer. Sarcomas, these are malignant tumors of connective or other non-epithelial tissue. Bone is one of the most common cancers in this category. Lymphoma is cancer in the lymph nodes, and leukemia is cancer that starts in the blood stem cells, which is in the bone marrow. Depending on what type of cancer it is, depends on the treatment course, and there may be differences in exercise restrictions. So, for example, people with leukemia, depending on what type of treatment they get, one of the recommendations is often to avoid places with a lot of people, as like gyms, for a year after their treatment. So that's something to be aware of. So like I mentioned, everybody has undetectable cancer cells in their body. Our immune system surveys and kills the cells before they become serious. That's before they are able to go somewhere and grow. So when the cancer cells evade detection or outpace the immune system, that is when the detectable cancer develops. These cancer cells form by inherited genetic mutations or mutations from exposure to carcinogens. So example, tobacco, the sun. There's probably other things as well. Those are 2 common ones that are easily modifiable. And the cancer cell growth outpaces normal cell growth. Our normal cells get to a point where they're fine, they're crowded, they don't want to grow anymore, whereas the cancer cell doesn't mind. It doesn't mind the crowding, it's going to keep growing. Factors that contribute to the development of cancer include family history. You can't do too much about that. Age, can't do much about that. Environment, we can modify our environment. Lifestyle, this one's big. This is a hugely modifiable one. This is where exercise fits in. So tobacco use, we can modify that. Physical inactivity, alcohol consumption, diet. With physical inactivity, we're also going to include exercise as part of that. Exposure to certain viruses and or bacteria or UV radiation. We can avoid some of that. We can avoid the sun, the UV radiation. There's the HPV vaccine, for example, that can help reduce the risk of cervical cancer. And then inflammation is also related to cancer, especially GI cancers, colon and esophageal, bladder as well. Not inflammation like you sprained your ankle, so you might get esophageal cancer, but a type of systemic low-grade inflammation. We'll talk about that more with the cardiovascular disease lecture next. All right, let's talk about some fun stuff. This is a research study, and it's posted in the topic folder for the exercise oncology. What this is a time-lapse picture up to 360 minutes, right at 340 or 360. So when the immune cell finds its target. So this red kind of clumpy thing, the red cell kind of on the edge of the screen and the red clumpy stuff, that's the NK cells and the stuff that they use to kill the cells. The green cell is from a cancer cell line. And this black one is also from the cancer cell line, but it's dead. And so through the time-lapse video, you can see the NK cell for natural killer cell. As the name suggests, one of the things it does is it kills cancer cells. So it's going towards the cancer cells. It detects it. There's antigens on the surface that have let the NK cell know that this is a cancer cell, that's something it should kill. And it makes its way towards it. It does its enzyme. It has enzymes that kill the cancer cell. And then he knows it's becoming red because it's taken over from those enzymes from the NK cell and turning black like the one that's already dead. So that's pretty cool. That's what NK cells do. This is their natural thing that they do. And we may be able to influence our NK cells through exercise. This is one potential mechanism for exercise to reduce the risk of cancer development and enhance cancer treatment. So in this study, it was done by mice, done in mice, not by mice. Mice were the subjects, not the experimenters. And they had voluntary wheel running. So with mice, you can put them on little treadmills, or you can just leave a wheel in their cage. That's called voluntary wheel running. They have access to it. In some studies, they'll tell you they had access during this time of day, and other times they'll just say, they had access the whole time. In the mice, they induce liver tumors. So this is one of the advantages to using mice. Their immune systems are quite different from humans, and the way they get cancer is much different than humans, but we can't really take human subjects and give them cancer. And so this is one of the advantages to using mice. It's what we have. So we put up with the limitations because we can't give humans liver cancer or any other cancer for that matter. There was 4 groups. There was a no exercise control group. There's a group that had access to the wheel before the tumor induction, one that only had running after the tumor, and then one that had running before and after the tumor. I like looking at the little schematics for it. So again, this is the same thing. So control, no wheel access, exercise pre, before cancer, exercise post, only after cancer, and then the exercise group had both before and after cancer. And when looking at the NK cells in the mice, the tumor volume is one of the measures of progression in mice and how exercise can potentially help it, because the faster a tumor grows, the bigger it gets, the harder it is for the immune system to take care of it, for pretty much everything. The larger tumors are more invasive to remove, the more likely to spread, because it's more, the bigger it is, it's usually the more advanced and so forth. So it's just a way to measure, to marker this. Also in mice, when they induce these tumors, they grow pretty fast. You'll notice here, days from inoculation, 15 days out, the experiment's over. Whereas in humans, 15 days wouldn't even be a detectable time for a cancer. Right. So in this one, the group that exercised the whole time, that exercised before the cancer, did better than the groups that did not exercise and that exercised only afterwards. Now, exercising afterwards is probably still better than not exercising at all, but being physically active before cancer diagnosis helps the mice with this tumor volume measure. So a lot of times I hear people be like, oh, so-and-so ran every day and they still got cancer. So I don't understand what why that's so good. Well, they may be more likely to survive cancer. They may have fewer side effects. They may have more skeletal muscle mass, which means they're less likely to get cachexia. There's a lot of other benefits to exercise besides just reducing cancer. So even if you exercise and still get cancer, you're still better off than if you weren't exercising and got cancer. Right. So again, the group that exercised the whole time or exercised before the tumor induction were the ones that did better. And let's look at a third and final study. This one's in humans. So we started with cells and then to mice, to our models, and then into the humans. And a lot of times this is the way, not a lot of times, but this is the way how a lot of clinical research goes. It's first done in cells and get your hypothesis, solid hypothesis, and then, okay, let's test it in animals. All right, hypothesis is really solidified, and then now it's okay to do in humans. So in this one, there is breast cancers, and they had breast cancer survivors, and they did a 15-week exercise intervention. The main thing to take away from this, it's a whole bunch of numbers about natural killer cells and changes in natural killer cells. But what is, which I want you to notice, is that for pretty much all of these, the exercise group, well, they were all different between the exercise group and the control group for all these measures. And of course, it was better in the exercise group than in the non-exercise group. So even in humans, there's potential for exercise to improve NK cell function. So how does exercise prevent cancer when we're talking about the immune system? So we just, all these studies were about NK cells, which is in part of the immune system. And it may be that chronic exercise optimizes regular immune function, for lack of a better word, let's say optimizes. How it does that, we're not sure. One of the ways may be through this improved actions of NK cells. Each time we do acute exercise, there's increases in hormones helpful to our immune system. And there's also release of helpful immune cells. The T cells also seem to be more responsive to pathogens. So T cells, I think we're a little more familiar with T cells than we probably were 3 years ago. These are the cells that get talked a lot about with COVID. These are the cells that help us fight the infection, that respond to the vaccine, and they respond to cancer cells as well. There's a whole class called cytotoxic. They're kind of like the NK cells that go and they seek out cancer cells and kill them. And it may make the NK cells more K. The natural killer cells do more killing activity. It's kind of a silly way that I wrote that. So it may just be that with these acute exercises, every time somebody exercises, they have this increase in hormones, they have this increase in release of helpful immune cells. Then over time, that may be the chronic adaptations, that each of these little individual helpful bits add up. Which is the term we use for exercise in cancer survivors, whether they're in treatment or post-treatment. So why exercise and physical activity for cancer survivors? And we use the term cancer survivors to mean anybody who has cancer and is still living. So if they are in treatment, they're still cancer survivors because they are surviving cancer. If they're post-treatment, again, they're cancer survivors. We just make the distinction on whether they're in treatment or post-treatment. Higher volumes of physical activity are associated with lower risks of developing 13 types of cancer and a reduction of cancer-related mortality. For a lot of connections we have with exercise and health, we'll say exercise may do this. Exercise may lower your blood pressure. Exercise may improve your blood lipids. But with cancer, the relationship between these 13 types of cancer and exercise and physical activity is so strong, we go as far as saying it will reduce. Regular and sufficient physical activity after diagnosis of early stage, potentially curable cancer is associated with a lower risk of cancer-specific mortality in breast, prostate, and colon cancer. These are the 3 types of cancer that we have a lot of evidence for exercise and for physical activity at reducing the risk of both developing these cancers and helping with survival. So what does exercise do? It helps mitigate the side effects of cancer therapy, and it improves functional measures in the individuals with cancer. Exercise is safe for almost everybody, including cancer survivors in treatment and post-treatment. For most people, the health benefits of exercise outweigh the risk for most people. There will probably be periods of time where it's not recommended that somebody with cancer exercise. For example, there's some debate about with some cancers and the timing of the chemotherapy and exercise. So for example, exercise shifts blood to the muscle. Do we really want that if somebody is about to have a chemotherapy treatment? Do we want them to have the blood flow more evenly distributed and potentially going to the organ that needs the blood flow as far as the delivering the chemotherapy drug? We don't have a solid answer for that, but that's one of the things that we discuss in this field. But again, broadly speaking, exercise is safe for almost everybody. There's additional contraindications to be aware of, some timing issues as well, but we still recommend, at the very least, being physically active and reducing sedentary time for cancer survivors. Exercise is beneficial at every stage of cancer, at preventing cancer, certain cancers, during treatment stage, and in the post-treatment stage. I really like this figure from the American Institute for Cancer Research, AICR, because it shows how physical activity and exercise can impact cancer risk. So at the bottom here, this is the person that has the lowest risk of developing cancer, and at the top is the person who has the highest risk. And with this, just assume that everything else is the same: hereditary, diet, et cetera, are all the same. And so we're just looking at physical activity and exercise. So this lighter color yellow, kind of almost a lime green, is how much time is spent doing non-sedentary activities. So not necessarily exercise, but getting up and taking a break every hour. So for example, if you have a Garmin or an Apple Watch, you may have a setting on it where every hour reminds you to stand up. So it would be stuff like that. The dark green is the time spent in exercise, so planned activity of a moderate to vigorous intensity. And so you notice on these bottom three people, all three of them have the same amount of exercise, and they do it at different times of the day. And that's not what matters, the different types at different time of day. What matters is the additional physical activity. So the person who's taking regular breaks throughout the day, making sure they're not too sedentary, has the lowest risk for reducing cancer. Whereas the person who does, this person right here, second from the top, I think his name is Mike, he also does the same amount of physical activity, but he's a lot more sedentary throughout his day, which increases the risk for cancer. So some things to think about before we do exercise prescription for cancer is to think about anatomical and physiological changes as a result of both cancer and cancer treatment. What are potential barriers to exercise for somebody who's a cancer survivor? What modifications do cancer survivors need? And for you personally, what do you know about cancer and how you think exercise fits in for survivors? So I just gave you a bunch of hints about what we should be thinking about that.